Today's edition is brought to you by VFIS of Canada, a division of CVIS Incorporated, Canada's largest insurer of firefighters. This week, we're bringing you an update on how the pandemic is affecting the Canadian Fire Service. Then, in our latest podcast of Firefighting in Canada, sponsored by Fort Garry Fire Trucks, we hear observations on the COVID-19 crisis from Fire Chief John McKierney, President of the Canadian Association of Fire Chiefs. And we'll highlight current studies seeking firefighter participants. In the past week, there have been several developments and changes in the response to COVID-19. Firefighters from some departments across the country will no longer attend or will be limiting their response to medical calls. Last week, Nova Scotia announced its firefighters will only respond to certain medical calls. Vancouver also recently reported looking at changes to its non-critical medical call response. Montreal Fire Services announced this week that they will only respond to the most critical emergencies in an attempt to prevent further spread of COVID-19. In Ottawa, firefighters will be wearing SCBA to some medical calls, and the department published a public service announcement to show the community how firefighters will look when arriving depending on the type of call. In the past week, several firefighters have tested positive for the virus. Among them was 8 firefighters from the GTA and an Ottawa district chief. The Winnipeg Firefighter Union is now also calling on the city to ensure workers' compensation claims are streamlined during the COVID-19 crisis, especially in light of PPE shortages. Prime Minister Trudeau recently announced a commitment of $2 billion to help buy PPE for frontline workers. On Tuesday, Public Safety Canada issued a survey pertaining to critical infrastructure owner and operator needs. This survey is open to all fire departments and can be found on the CAFC's COVID-19 webpage. The CAFC is offering a free temporary membership to all departments during the pandemic. In the latest episode of the Firefighting in Canada podcast, President of the Canadian Association of Fire Chiefs and Fire Chief in Whistler, BC, shares his observations on the Canadian fire departments and the response to the COVID-19 pandemic. He explained that many departments are using their knowledge from SARS and H1N1, but seeing as this virus is unprecedented, are having to change how they respond to calls.
In the next coming weeks, firefighters will be performing medical calls more so than anything else. And so we are bringing this forward to the Public Health Agency of Canada that firefighters across our country has to be viewed as part of the healthcare system and has to be able to get the right equipment in order to ensure that the other parts of the health community are not overburdened unnecessarily. We are part of that equation right now.
A main concern at this time is the lack of adequate PPE for firefighters. McKierney said he is now calling on government entities to step up.
We're taking this opportunity to remind our federal ministers and federal government and provincial government, firefighters are there. They're a valued resource in the community, and please don't forget about them. They are on the front lines. They need the right equipment.
He also reminds people that the CAFC has a free COVID-19 reference page with the most current information for departments to consider. He also notes there is a COVID-19 Chiefs chat room for those who are not members of the CAFC to use as a resource while Canada works through the pandemic. 2 different studies are seeking firefighter participants. The first has a focus on exercise and training injuries, and the second study has a focus on cancer in female firefighters. The Firewell research team is conducting a study on joint and bone injuries that occur in firefighters during training. The team has found that firefighters have high rates of bone and joint injuries, but were surprised to find out almost half of these had occurred during exercise and training and not on the fireground. Canadian firefighters, career or volunteer, with past or current musculoskeletal injuries such as strains, sprains, or broken bones from exercise or training are invited to answer a 15-minute anonymous survey. Those interested can find the study at firewell.ca. The BC Injury Research and Prevention Unit is conducting a study on cancer in female firefighters. Female firefighters either born female or now self-identifying as female from the United States, Canada, United Kingdom, France, Australia, and elsewhere are being sought to participate in a research study conducted by the University of British Columbia. The study is confidential, takes about 10 to 20 minutes to complete, and will include questions about demographics, firefighter career, lifestyle, work-related injuries, if any, and cancer experience, if any. For the link to the survey, visit firefightingincanada.com. Results from the research will be used for developing and evaluating health and wellness policies, designating resources, and designing screening, surveillance, and prevention strategies. Thanks again to VFIS of Canada, a division of CVIS Incorporated, Canada's largest insurer of firefighters. Stay tuned for our next episode on Friday, April 10th.